Hello, this is Dr. Patrick Hu from Moffitt Cancer Center. We're really privileged today to have Dr. Sarah Hoff, who is head of the section of GI radiation oncology at Moffitt Cancer Center and an expert in virtual reality. Dr. Hoff, thanks so much for being here with us.
Oh, Dr. Hu, it's a pleasure. And it's really an honor to talk about this important topic today, because I really do believe as the years go by, more and more patients are going to benefit from it.
Well, as you know, scans and radiation can cause a lot of anxiety in our patients. Tell me about the virtual reality project Moffitt is working on and how this is going to improve the patient experience.
Yes, I mean, you really hit on a very profound problem. When you take a patient who's newly diagnosed and you tell them what is going to be involved in treatment, particularly if they have to go through a narrow tunnel and they have to lay there and they have to intermittently hold their breath. You can imagine telling someone that on initial consultation day. So because I do this professionally and feeling like the experience could be improved, about 3 or 4 years ago, I started toying with the idea, what can we really do to make it better? And how can we use an immersive media like virtual reality so that the patient can be desensitized and the patient can feel like they're going through the experience virtually before they go through the experience in real life?
I find it very interesting that we're collaborating with Ringling College. So tell us how we ended up collaborating with the Ringling College of Art and Design.
For some of your viewers who may not be familiar with Ringling College of Art and Design, it's actually the #3 art school in the world. And I've been a fan of Ringling College for many years. And I've also been a fan of the need that we have to have more creativity in healthcare. And we have the ability now to collaborate with Ringling, not only in virtual reality, but with visual arts. So I think, Dr. Hu, this is just the tip of the iceberg. And I think there's so many amazing things we can do together.
Are we currently using this technology with patients at Moffitt Cancer Center?
We're going to be testing it. What does the prototype look like? How should the prototype be with patients? And I think for your audience, it's important to know the importance of patient-centered design. So we actually had 2 of our Moffitt patients, one who's gone through the experience, one who's been cured of pancreatic cancer and hadn't gone through the experience because he was cured 15 years ago. And they had a lot of input. How should the headset be? What type of game should we play to train patients to use their breathing? So the next step, Dr. Hu, is we have grant funding that we're going to be using to conduct a feasibility trial. So we're doing that with Dr. Robinson, Dr. Gonzalez, and we're, in the middle of that right now. So very soon, because we have it, but very soon it will be in the clinic being tested so that we can give you data on it, so that someday in the future you can invite me back and I'll tell you how much patients liked it.
That's wonderful. So why don't you describe it a little bit for what the experience is like?
So basically the experience starts, they put on the headset, they'll be in the clinic, we'll relax them with 2 games. The games are very strategic. The games teach them to hold their breath, because in the MRI machine, you have to hold your breath for 25 seconds at a time. And that may sound easy until you try to do it. So the games will desensitize patients and get them to train their breathing. Then the patient will recline in the exam table, still with the headset on, and now they're in the MRI machine. So you can imagine they're actually laying there, they're going through the tunnel, and they're actually seeing what it's really going to be like when they go in the room. And our hope is we can come back with data for you sometime to show you how effective that is.
So what are the plans for the future? How else do you see virtual reality coming into cancer care and treatment?
Absolutely. I think the future is very bright. And I think at Moffitt currently, you have pockets of innovators. You have pockets of innovators like our project here, Brian Gonzalez. So you have pockets of innovators. I think the future under your leadership and that of Dr. Robinson is to scale it. So we need to think about how are we going to scale it across the organization so that each clinic, each department benefits. And Dr. Green and I have actually already been starting those conversations. We want to make sure that in the future, we have the infrastructure for the entire organization, and not only for the clinics, but for diverse patient populations. We want to make sure that no matter who walks through our door, we have the ability to put the headset on, transport them to whatever is needed, and give them access. And so we think that that is an amazing goal, and we think it's near term within the next few years.
So many potential uses of virtual reality in the future. It's just so exciting. Thank you, Dr. Sarah Hoff, an expert in virtual reality and the section head of GI radiation oncology at Moffitt Cancer Center. Thanks so much for being here today with us.